frequently asked questions on autism spectrum disorder. What is autism spectrum disorder? Autism spectrum disorder (ASD) is a developmental disorder that affects communication and behavior. Although autism can be diagnosed at any age, it is said to be a developmental disorder because symptoms generally appear in the first 2 years of life. Why is autism known as spectrum disorder? Autism is known as a spectrum disorder because there is wide variation in the type and severity of symptoms people experience. What are the causes and risk factors? While scientists don't know the exact causes of ASD, research suggests that genes can act together with influences from the environment to affect development in ways that lead to ASD. Some risk factors include having a sibling with ASD, having older parents, having certain genetic conditions. People with conditions such as Down syndrome, Fragile X syndrome, and Rett syndrome are more likely than others to have ASD. Very low birth weight. What are the signs and symptoms of ASD? According to the DSM-5, a guide created by the American Psychiatric Association used to diagnose mental disorders, people with ASD have difficulty with communication and interaction with other people, restricted interests and repetitive behaviors, symptoms that hurt the person's ability to function properly in school, work, and other areas of life. What are the examples of deficits in social communication or interaction behavior? Deficits in social communication or interaction behaviors may include making little or inconsistent eye contact, tending not to look at or listen to people, rarely sharing enjoyment of objects or activities by pointing or showing things to others, failing to, or being slow to, respond to someone calling their name or to other verbal attempts to gain attention, having difficulties with the back and forth of conversation, often talking at length about a favorite subject without noticing that others are not interested or without giving others a chance to respond, having facial expressions, movements, and gestures that do not match what is being said, having an unusual tone of voice that may sound sing-song or flat and robot-like, having trouble understanding another person's point of view or being unable to predict or understand other people's actions. What are the examples of restrictive or repetitive behavior? Restrictive or repetitive behaviors may include repeating certain behaviors or having unusual behaviors. For example, repeating words or phrases, a behavior called echolalia. Having a lasting intense interest in certain topics, such as numbers, details, or facts. Having overly focused interests, such as with moving objects or parts of objects. Getting upset by slight changes in a routine. Being more or less sensitive than other people to sensory input, such as light, noise, clothing, or temperature. What are the comorbidities of ASD? Psychiatric conditions. High prevalence for anxiety, ADHD, depression. Motor impairments. Can include hypotonia, apraxia, clumsiness, toe walking, and gross motor delays, may improve through therapy or naturally over time. Insomnia. Intellectual disability. Epilepsy. Gastrointestinal problems. Chronic constipation, diarrhea, and abdominal pain. How is ASD diagnosed in young children? Diagnosis in young children is often a two-stage process. Stage 1, general developmental screening during well-child checkups. Every child should receive well-child checkups with a pediatrician or an early childhood health care provider. All children be screened for developmental delays at their 9, 18, and 24 or 30-month well-child visits, and specifically for autism at their 18 and 24-month well-child visits. Parents' experiences and concerns are very important in the screening process for young children. Sometimes the doctor will ask parents questions about the child's behaviors and combine those answers with information from ASD screening tools, and with his or her observations of the child. Children who show developmental problems during this screening process will be referred for a second stage of evaluation. Stage 2. Additional evaluation. This second evaluation is with a team of doctors and other health professionals who are experienced in diagnosing ASD. This team may include a developmental pediatrician, a child psychologist and/or child psychiatrist, a neuropsychologist, a speech-language pathologist. The evaluation may assess cognitive level or thinking skills, language abilities, age-appropriate skills needed to complete daily activities independently, such as eating, dressing, and toileting. The outcome of the evaluation will result in a formal diagnosis and recommendations for treatment. What is the treatment for ASD? Treatment for ASD should begin as soon as possible after diagnosis. Early treatment for ASD is important as proper care can reduce individuals' difficulties while helping them learn new skills and make the most of their strengths. The wide range of issues facing people with ASD means that there is no single best treatment for ASD. Working closely with a doctor or healthcare professional is an important part of finding the right treatment program. Medication. A doctor may use medication to treat some symptoms that are common with ASD. Atypical antipsychotics aripiprazole and risperidone are the only medications approved by the FDA for the treatment of ASD. With medication, a person with ASD may have fewer problems with irritability, aggression, repetitive behavior, hyperactivity, attention problems, anxiety and depression, behavioral, psychological, and educational therapy. People with ASD may be referred to doctors who specialize in providing behavioral, psychological, educational, or skill-building interventions. These programs are typically highly structured and intensive and may involve parents, siblings, and other family members. Programs may help people with ASD learn life skills necessary to live independently, reduce challenging behaviors, increase or build upon strengths, learn social, communication, and language skills.
Audio Jungle. Audio Jungle.